then
Oh,
it
and it
like
turned
kind of
off.
went over there, yeah.
But that's probably better because you would have a huge file and it would be really
You're
hard to
right,
upload.
exactly.
So the first one's like around 10 minutes.
Yes.
Okay, good, okay, so we'll start.
Can you
Guess-
cut out portions too if you want to?
Probably, but I'm,
You can edit
I,
it and put
I'm
it
not
together and break it
technologically
apart.
that competent.
But your son, who said
Oh,
the
no.
bear is pooping in the woods.
Okay, so I've listened to the heart, and now we're gonna go ahead and listen to the lungs, okay? Now, of course, we listen 6 places in the front, all right? We wanna listen, we've got lung tissue up here, right? So when I listen, I'm gonna listen with the diaphragm, okay? And I listen, we won't do that this time, but what you need to do is listen for a complete cycle, inspiration and expiration at each spot, okay? If you just put it here and just put it here, you haven't listened. Okay, so I'm gonna listen here, inspiration, expiration, and I can ask the patient to take a deep breath from me. I'm gonna listen here above the clavicle, and I'm gonna listen here, and I'm gonna listen here. And the other place I need to listen is right about the nipple line, here and here, okay? Now, I go ahead when I'm right here, and I start at the back, and I ask the patient to take a deep breath, and I believe you need to listen in 8 spots. So here's how I do it, or 8 spots in the back. Take a deep breath. Here. Let's see, I'm gonna just spin you around so we can see. So I started here, can you see? Okay. And then I move over here, and then I go down, and then over here, and then I go down, and then over here. Are you able to tell that, Karen, from there?
It's the chair, the back of the
So
chair.
what
isn't
I'm
it?
doing, okay, stand up for me, please. Okay. And then I go here, and then I go here. Now I need to listen to the lateral lung fields too, so then I'm gonna come here on the side, okay, and right here. If my patient's in the bed and not able to stand up, at this point I'm also going to check CVA tenderness, which is costo-vertebral angle, costo-ribs vertebral angle. I'm going to check for tenderness, okay? I usually put one hand in the front and I just press. I don't do this banging stuff. I don't know if they showed you that, but if you have a patient who's got renal problems and you hit them like that, you are causing them unnecessary pain. If someone's got CVA tenderness, you don't even have to do that. You can do like this, but that's still quite painful. Usually what I do is I just press here, and then I put another hand on the other side, and I press here. Do you have any tenderness? If they've got, significant problems, that's going to be enough, okay? I'm also looking for sacral edema at the same time. So I'm not going to lift her shirt, but I'm looking when I'm inspecting for sacral edema, okay? And then I've inspected her back now, okay? I'm looking for symmetry at the same time. Always, every part, symmetry. I'm inspecting her skin to make sure there are no lesions. If she has a mole, I'm gonna say, did you know you have a mole here? Has anybody ever checked that? Those kinds of things. Okay, I'm looking for scars. Oh gosh, you got a scar there. Yeah, I don't have a right kidney. Okay, anytime I see a scar, I wanna know what that scar's about. And it's appropriate for you to ask personal questions that you wouldn't normally ask, okay? So I don't see anything. Her back is symmetrical. If you'll sit back down for me, I'm gonna put you back on. Okay, this way. Now, I'm gonna check the rest of her pulses before I do her abdomen, okay? So I'm gonna check the brachial pulse here. And we know that if we hyperextend the elbow, that we can find the brachial pulse. Even if you don't feel it that day, say, now I'm palpating the brachial pulse, okay? The examiner's not gonna stop and say, here, let me see, okay? And then you're gonna palpate the radial pulse, okay? And then I'm gonna palpate the ulnar pulse, and I should do it on both sides. Don't forget we have 2 sides. So I'll do it on the right and then on the left, okay? And then I've already had her squeeze my hands, so I'm looking, all this time I'm inspecting her skin, I'm looking for rashes, bruises, lesions, and scars. Okay, I want to know how long the rash has been there. I want to know if there's a bruise. Are the bruises staged? Have I got a fresh bruise here and an old bruise there and one in the middle someplace else? That's significant, okay? Especially with your little old folks, because they are at risk for abuse, elder abuse. So I'm going to check capillary refill, and it should be less than how many seconds? 3 to 2. Yeah, exactly, 2 or 3. And it's so fast that you can hardly see it. Okay, and I'm noting that, she trims her nails, she doesn't chew her nails. If she chewed her nails, I might be thinking in terms of anxiety, but I'm looking at the nails to make sure they're normal. Do they have you doing this? Okay, good, we won't worry about that right now. We've already checked the strength. Okay? So far, I have looked at pulses in the upper extremities, and I have looked at the heart, and I've looked at the lungs, and now I'm gonna inspect her abdomen. So I'm inspecting right now, just looking again, rashes, bruises, lesions, or scars. I'm looking to see if I see any, I'm looking for the contour of the abdomen. Is she pregnant? Does she have ascites? Is her abdomen flat? Is it scaphoid? Is it obese? Those are all things that I'm looking at as I'm looking at her abdomen, inspecting before I do anything else. And then I'm going to auscultate, okay? Do they have you checking for the aortic?
Yes.
The auscultating the aortic?
Aortic, renal, iliac, and femoral.
Okay, you're going to tell how you're going to do that, but it's very difficult to do. But you will listen at all those arterial places with the bell of your stethoscope. But right now, I'm just auscultating for vowel sounds, okay? And I look in I listen in all four quadrants with the diaphragm of the stethoscope. So again, I'm very systematic. I start here, I listen. I'm a little bit high. And then I listen here. And then I listen here. And then I listen here. Now, we want at least 5 vowel sounds per quadrant, right? Okay, so they may ask you that, how many vowel sounds do you hear? So I listen, and then I turn the stethoscope around, okay? And then I listen for aneurysms, okay? With the bell of the stethoscope right along this side right here. Now, remember that the iliac arteries bifurcate right about here, just below the navel. So I'm going to listen at the bifurcation point on either side, and then I'm going to listen femorally, okay? For the pulses, and I'm also listening for bruits. Okay? I don't know whether they will have you actually check or just tell that you're checking femoral arteries. I don't know how your partners are going to do, but that is important to do. I will tell you all, usually what I will do is check the pedal pulse. If I have a pedal pulse, I know my other pulses are intact when I'm in the hospital. If I don't have a pedal pulse, then I start moving up towards the thigh to figure out where I lose that pulse, okay? So reflexes, I think, are on there at the end. If I had a reflex hand, which is pretty, okay. Her leg would have to be completely suspended, and then I would just check her reflexes on both sides to make sure they're symmetrical. And when I inspect pulses, the best way to do the popliteal pulse at this point, it's almost impossible to feel unless you have a patient lying on their stomach. And how many patients in the hospital are comfortable lying on their stomach? So popliteal pulse is right here behind the knee, and you can say, now I'm palpating the popliteal pulse. Okay, and then I'm coming down here to the tibial, which is on the outside, right? Medial, correct me if I'm wrong. Medial and then lateral, medial, lateral on the outside. I'm checking here, then I check the pedal pulse right here, okay? And slip your shoe off for me, Carol. What I do is I take my fingers, I run up the toe, and I can feel it right there, okay? Now, if the patient's toes are warm and pink, we know they have a pedal pulse. So at the same time at the patient's feet, I'm inspecting the toes to make sure they're warm and pink. And if they're warm and pink, I know I've got a pedal pulse, I just have to find it. If I can't find the pedal pulse, I have to get a Doppler. So go ahead and put your shoes back on for me. So we've done this part of the exam at this point, and now I need to check some things like gait and balance. Now that I have ascertained that she has strength in her legs and her upper extremities and that all her pulses are present, now I feel comfortable getting her out of the bed, okay, if she's in the bed, and having her walk around. So Carol, would you walk around for me, please? Okay, would you walk towards Karen and do toe heel like this, one toe in front of the other? So I'm checking her balance and making sure that she can heel toe heel. And now would you turn around and walk back towards me? Just normal. Just normal gait, yeah. So I'm making sure that that her gait is normal, that she has an appropriate gait. Okay, I want to do something called a pronator drift. Okay, put your arms straight out for me, okay? All right, and close your eyes. Now I'm going to press down on her hands like this. Let me press down, okay? Don't resist. Oh, but let them come back, I'm sorry. Okay. They should come back without doing anything, okay? Does that make sense to you guys? Okay. Now open your eyes for me. Okay. Okay, so there we go. I want you to shut your eyes. Okay, and what I'm doing right now is getting ready to do a Romberg sign, because with her eyes shut, I want to see if she's able to maintain her balance. Okay, put your hands flat down to your side. Okay. Now she may waver just a little, but she shouldn't fall. Okay, open your eyes now. All right. On your test, on your examination too, it talks about having done the Snelling and having done the reading tests. So be sure that you add that piece in there. And this is a good time to do the Snelling test, is the test for vision, for distance. And then you can give the, and you cover one eye and then uncover the other eye, or cover and uncover, or cover, however that works. Same thing with reading, you're gonna have the patient something that's got small print, and ask them when they can read, and you cover one eye and then cover the other eye. And I think that that's it. Sit back down for me. Stop the video, please, Karen.